Welcome you all back to my channel Paints Again. So today we are going to start a very new series of clinical hematology series. And today through this series we will be completing the entire hematology from the physiology point of view, from the pathology point of view, and also from the general medicine point of view. So this hematology, this complete hematology series will be available in my YouTube channel for free, and I have to assure you that this will be the top-notch class for hematology. Because before coming and taking class, before I am coming and standing near my whiteboard, I had referred to number of hematology textbooks, number of physiology, pathology, general medicine, and even pediatrics textbook. And also last I referred to Harrison and also Robbins, and I also referred to a number of classes by a number of faculties at the top notch coaching centers also, so that I can deliver the most authentic and also most top notch content to you. So everything will be available for free, and complete hematology, complete unit of hematology will be available for this. And also you just don't have to refer any single source for hematology. If you are seeing hematology lectures of mine, then you don't have to refer to any single textbook, because each and every line of Robbins, Harrison, or any other top faculties I am explaining in my clinical hematology series. I am explaining. And also, this will be a very high yielding session for your NEET PG, INSH, or for your university exam. If you are a first year, second year, or a fourth year student, please watch the complete hematology series. Be consistent with me, because it will be very fruitful. Or even if you are a person who had cleared NEET PG also, or if you are someone who is very curious to learn about the medical education, or if you are someone who is who is a nurse or something, who is doing BDS or any other field related to medicine also, if you are keen to learn about hematology, it will be very helpful if you can actually have a complete understanding of the entire hematology from my video. So I will be teaching you how to apply the concept while you are seeing a patient. So everything, my entire hematology class will be clinically oriented. So whenever a patient is going to come to your clinic with a CBC report, whenever a patient is coming to your OPD, the first and the foremost thing you have to check whether the issue is a single lineage issue or it is a tri-lineage issue. Always find out this. Whenever a patient is coming to OPD with a RBC value or hemoglobin value distortion, don't directly give them iron tablet and send them. No, this is how you should approach. This is what is given in Harrison textbook of general medicine. This is how you have to approach a patient who is coming with a CBC report. If a patient is coming with CBC report, the first and the foremost thing every person, every clinician, every doctor, every medical student, and everyone who is watching over here should do is, you have to identify whether the problem is a single lineage problem or it is a tri-lineage problem. Now, I know everyone used to have what is single lineage, what is tri-lineage. Everyone will be so much confused. Now, no need of any confusion. Single lineage issue means if there is a problem with RBC count or WBC count, or it is a platelet count distortion. If there is any sort of distortion with any one among the following, RBC, WBC, or platelet, you will be calling it as a single lineage issue. Now, if there is a distortion in all the three, RBC, WBC, and platelet, you will be calling that condition as tri-lineage, and you will be calling that as pancytopenia. When there is a decrease in RBC, decrease in WBC, and decrease in platelet, you will be calling it as pancytopenia. Clear? Is it clear for you all? Now, we are just taking RBC. We are just focusing on RBC now. For our first part of the video, for our first half of the video, we will be discussing completely about RBC. So we are just focusing our complete focus. We are just giving the complete focus on RBC. Right? So RBC, this pancytopenia can occur in a different types of condition. And I have to point one question also. About 15 to 20% of the patients who are coming to a clinic with megaloblastic anemia, they can also present with pancytopenia. It is given in Harrison very clearly that 15 to 20% of the patients who are suffering from megaloblastic anemia can also have pancytopenia. There are a different number of conditions where pancytopenia is actually present, and I will also make a complete video about pancytopenia, but I have to give you a catch. I have to give you a very important previous year question, a very important statement given in Harrison that 15 to 20% of the patients with megaloblastic anemia can present with pancytopenia. Now we are just focusing on RBC. The decrease in the RBC count, or if there is a distortion in the hemoglobin levels, that is decrease in RBC count or decrease in hemoglobin level or decrease in hemoglobin and decrease in RBC both. Three cases, either like decrease in RBC or decrease in hemoglobin or decrease in both, we will be calling that as anemia. According to the WHO, World Health Organization, what is the criteria for anemia? So how we will be calling a person as anemic? Then the WHO criteria, it says that for a person, a male, female and pregnancy, there are three criteria in hemoglobin. So for a 40-year-old male and female, it is saying if the hemoglobin level is less than 13 gram per deciliter or less than 13%, and for a female less than 12 gram per deciliter or less than 12%, and for a pregnant female, males won't get pregnant, right? So pregnancy or a pregnant female, it is less than 11 gram per deciliter or less than 11%, then we will be calling that person as anemic. Clear? This is the correct picture of what? Anemia according to hemoglobin level. So what is anemia? Anemia means decrease in the RBC level. It is in the decrease in RBC level or decrease in hemoglobin level or both. That is what is called what? That is what is called the anemia. That is the what is the two classification? Male, female and pregnancy. That is the these are the levels. Below these levels, then we will be calling that person as anemic. Now we have to just focus upon the hematopoietic stem cell. So from where all these things are forming, right? So we have hematopoiesis, hemopoiesis or hematopoiesis. That means what? Hemopoiesis or hematopoiesis means the formation of the blood cells, WBC, RBC and platelets. And if it is especially RBC, then we will be calling it as erythropoiesis. Now, this hematopoiesis will be occurring, or hematopoiesis will be occurring from the cells, from the group of stem cells called PHC. From PHC. What is PHC? Pluripotent hematopoietic stem cell. Pluripotent hematopoietic stem cell. So from PHC or pluripotent hematopoietic stem cell, we are going to get the basic formation of your erythropoiesis. The basic hematopoiesis is going to occur. So from the pluripotent hematopoietic stem cell, common myeloid progenitor is going to come, and also common lymphoid progenitor is going to originate. So from the pluripotent hematopoietic stem cell, common myeloid progenitor and common lymphoid progenitor occurs. From the common myeloid progenitor, you will be getting RBC, you will be getting granulocyte. What are the granulocytes? BEN. What is BEN? Basophil, eosinophil, neutrophil. Again, you will be getting monocyte, which will be forming macrophages. And also it will be forming platelets. You will be getting platelets. From the common myeloid progenitor, you are going to get RBC, platelets, granulocytes, PEN, and also monocytes, which will be forming macrophages. Then from the common lymphoid progenitor, you will be getting lymphocytes, which will be again forming B and T lymphocyte, and also you will be getting NK cells. So there was a previous year INSS question. NK cells will be forming from which among the following? From the common lymphoid progenitor. So common lymphoid progenitor will be giving rise to lymphocytes, that is B and T lymphocytes, and also for NK cells. This is a very, very important portion. So then we will be moving upon for the very specific, we will be going and study the erythropoiesis. So in the next video, I will be discussing about the sites of erythropoiesis, then the stages of erythropoiesis and the regulation of erythropoiesis, which is a very important video. So this is how we have to approach anemia. Primarily, then we will be classifying anemia. In the subsequent videos, we will be progressing our knowledge, or we will be increasing our knowledge on hematology. So I think the first video you all might have understood what is anemia, how you have to approach a patient while coming to your OPD, but with a CBC report. What are the things you have to check in a CBC report in the basic manner, right? So it's a very basic class, and from here, from the top, base to the top only we are going. So this is the foundation, the very basic class. So we have completed the very basic understanding of of your clinical hematology unit. So I think you all must have understood this topic. So in the next video, we will be coming with a very superb class on erythropoiesis, the sites of erythropoiesis, the scales of erythropoiesis, and the regulation of erythropoiesis. Till then, it's me, Pranav Pinar, and also you all please share this video to your friends, to your family members, to everyone, to your college group, so that maximum people will be benefited from that. And also please do subscribe to my channel so that it will be a very big motivation to me, and all the number of likes in my video will be the motivation for me to make more and more videos.